RPG, get down!
On the battlefield, every second counts.
Need more people for litter bearers!
Here is where the military health system comes together to make the difference between life and death. This is where military medicine begins. In a single decade from some of the most austere places on Earth, we have built a lifeline that stretches thousands of miles. A lifeline that moves ill and injured service members from the point of injury to combat hospitals en route back home to the United States.
Blood pressure is 91/55.
Every step of the way, we deliver critical care. This remarkable health system of Army, Navy, and Air Force medical personnel cares for soldiers, sailors, airmen, Marines, Coast Guardsmen, and all who come in harm's way.
What we're doing today is digital subtraction angiography to evaluate the blood supply.
It's joint, it's integrated, it's impressive, and produced the highest survival rates in the history of warfare. But this is just one part of the military health system. The military health system is also a health delivery system. 57 hospitals, over 400 clinics around the globe. More than 9 million Americans who are military members, their families, and retirees count on us, and we deliver. Each year, over 50,000 babies, over 50 million prescriptions filled, rehabilitation, recovery. The military health system is also a medical education system. Each year, the Uniformed Services University produces over 300 military physicians and specialized medical leaders. And our medical education and training campus turns out over 26,000 medical enlisted personnel from every branch of service. We're also an integrated healthcare plan with a global network of care. We partner with civilian doctors and hospitals to deliver the promise we make to those who serve and their families. The military health system is also a public health system. Our military medical labs around the world conduct surveillance to detect and stop the spread of disease and to ensure the safety of the environment. The military health system is a national leader in medical research, collaborating with science and academia, bringing life-saving products to the battlefield and to every American.
Eyes blink, pupils dilate.
Simulated patients, life-saving blood clotting products, mind-controlled prosthetics, new vaccines, laboratory-grown skin, arm transplants.
It's like I went back 4 years and I'm me again.
Our research improves health, speeds recovery, transforms the practice of medicine.
The massive earthquake and tsunami that rocked Japan.
And we are a global force for good, responding to disasters and humanitarian crises whenever we are called, and building capabilities in our partner nations, floating hospitals, medical supplies, transport. It's joint, it's integrated, it's impressive. We're like no other health system in the world, and we're increasing our engagement with federal health partners, including the Department of Veterans Affairs, bringing Army, Navy, and Air Force medical capabilities together. This remarkable system exists for a primary mission, to ensure every service member, whether active or reserve, is ready. A system focused on health more than health care. A medical force ready to respond, ready to repair both the visible and the invisible wounds of war. A unifying mission, personal courage, and selfless sacrifice. Integrated care, world-class results. It's joint, it's integrated, it's impressive. We even make house calls, anywhere, anytime, like no one else. This is the military health system.